Yes. Moving to our program, we would like to call on once again our very dear 2021 JCI Manila President Richard Tamayo for our welcome remarks. Hi.
Welcome to JCI Manila's third joint GMM with the JCI Senate Manila and the JCI Makati Princess Urduha. It's entitled Beating the Virus and Understanding COVID-19 Vaccines. This topic could not have come timelier tonight as we have reached the 8,000 mark of daily COVID cases yesterday. I myself feel this as we have had the longest waiting for admissions in the hospital that I manage. We also have at least 40 healthcare workers affected and in quarantine. We are also out of stock of certain COVID medicines like Tocilizumab, and even suppliers are running out of this. These are just a few of the challenges that healthcare facilities and workers actually face. The struggle is real, not to mention when COVID-19 strikes close to home and to families. So a while ago, we actually have a fellow brother in the person of JCI Manila member, Mark Trinidad, who has recently fallen. Our prayers and sympathies go to his family and loved ones, especially in this most difficult time. Our prayers go as well to all JCI members, along with their families and friends who are currently struggling with COVID as we speak. We wish them a swift recovery. We started our rollout for vaccines for our healthcare workers last second week of March. But I could say that there is still more than half waiting to be vaccinated. Also, I was informed recently that the reserved second doses for those vaccinated during the second week of March are now being recalled by the DOH to be redistributed to other areas in the country. And they are hopeful that the second dose replacements do arrive on time on the 8th week. Things are seemingly bleak for us. I could imagine just how families affected are going through, might as well individuals who are facing severe or critical conditions. I myself was not spared with COVID, but with God's grace, I was given just mild symptoms and I did not infect everyone. COVID pandemic, being the second largest humanitarian crisis since World War II, reminds me of Winston Churchill. It was at that time that Nazi Germany already conquered France and the Luftwaffe was already heavily bombing the city of London. It seemed impossible to stop the German advance and that Axis occupation was inevitable. Britain and Winston Churchill was at their darkest hour. But yet it did not break their human spirit. In fact, they all the more got emboldened to fight. And with inspiring words from Winston Churchill, may I quote him, "Let us therefore brace ourselves to our duties, and so bear ourselves, that if the British Empire and its Commonwealth last for 1,000 years, men will still say this was their finest hour." Brothers and sisters, there is hope. Let us be the light in this darkness. We have great women speakers tonight, very timely as well in the celebration of Women's Month. They are one, or if not the best in their respective specialties. May tonight be of great value to you and your families. And do join us as we lead this one this year. This is just the start. Again, on behalf of the 2021 JCI Manila Board of Directors, let's all make this our finest hour. We are with you always. God bless. Do stay safe. Good evening, everyone.
Allow me to introduce the dashing president of JCI Senate Manila, none other than Winston Lawrence, Larry Wu.
Thank you for that, Jasper, SG Jasper. So I'm going to keep this short. Good evening to my fellow presidents, my co-presidents, JCI Manila President Rich Tamayo and JCI Makati Princess Urduha President Cheska Carrere, past presidents of all the chapters, fellow senators, JCI brothers and sisters. Welcome to the first joint GMM for the year. This would have been a good time to catch up with one another face to face, as it's been pretty much a year since we went on lockdown. But here we are again with a similar situation as the COVID numbers have gone up, as Press Rich mentioned, and things are not getting better. Having said that, fortunately, there seems to be a solution on the horizon now that the number of vaccines have been developed around the world. For the most part, the decision to get vaccinated should have been a pretty simple one. But with so much different information, opinions floating around, it's really made that decision quite complex. So we, the board of directors of all three chapters, hope that this timely GMM and the topic that we're going to talk about will actually make this decision much easier for you to make, especially for those that are heads of families, heads of organizations. We need to make the right decisions for the people that we lead. And of course, I'd like to thank the hardworking committee and directorates of all three chapters for making this all possible today. And of course, as we celebrate the National Women's Month of March, I would like to salute all the ladies, especially our three distinguished speakers, for all the hard work that you do and the difference that you make. And with that, keep safe, everyone, and back to you, hosts.
For the message of the Makati Princess Urduha President, let me call on President Cheska Carrer.
Good evening, everyone. To our esteemed hosts tonight, Dr. Regina Barba, Dr. Beverly Ho, and Dr. Fatima Santos Ocampo. And to my batchmate, Pres Richard Tamayo, the JCI Manila 2021 President, to the 2021 JCI Manila Senate President, President Larry Wu. Good evening, and to all the JCI Makati Princess Urduha past presidents and members who's here with us tonight, JCI Manila past presidents and brothers who is here tonight, and also for the JCI Manila Senate, and all to my DASIG batchmates, and of course to our AVP for Metro South, AVP Gino Haralve, and to our VP Karen Romarante. Good evening. Thank you for joining us tonight. It's actually the Women's Month, and as what my batchmate said, Pres Richard, that is very timely that we are having this topic for tonight. So we are very hopeful, and we are looking forward that at the end of this lecture, most of our unanswered questions, hesitations, and mostly the what ifs will be answered and clarified on why we have to have the COVID-19 vaccine. To all my sisters, to all my brothers, I hope this lecture tonight, we will appreciate everything what our speakers will impart us. And again, thank you for joining us, and have a good evening.
Thank you so much, President Cheska Carrer of JCI Makati Princess Urduha, and to all the other presidents for your message. We really are looking forward to tonight's event, tonight's speakers. I'm sure we have a lot of guests and participants, so I'm sure a lot are really looking forward to hearing our doctors later. Now, we have a short special message care of our Vice President Lenny Robredo. Let's play this video.
Isang mainit at maligayang Women's Month sa lahat. Sana ligtas kayo at nasa mabuting kalagayan. Natutuwa ako na despite the challenges of the pandemic, hindi natin nakakaligtaang isulong ang kapakanan ng kababaihan. Malayo-layo na rin ang narating natin sa usapin ng women's empowerment at gender equality. Pero hindi rin maitatanggi na napakarami pa natin kailangang gawin. Lalo na ngayong mas bumibigat ang mga pasaning dala ng kababaihan dahil sa pandemya. Cases of domestic violence continue to rise. Reproductive services have been hampered. And with lockdowns enforced, there are those that have become trapped inside their homes with their abusers. Many women have no choice but to suffer in the shadows. Pero sa kabila ng mga hamon, hindi tayo nawawala ng pag-asa. If our collective efforts are any indication, napakarami na nating humahakbang tungo sa mundong gusto nating puntahan. Isang lipunan kung saan lahat nasisilungan, lahat natutulungan, lahat naaaruga, anuman ang kasarian o katayuan sa buhay. On our part, while the pandemic forced the office of the Vice President to reorient many of our programs, haligi pa rin ng aming trabaho ang economic empowerment ng kababaihan. Dahil gaya nga ng palagi nating sinasabi, economic empowerment ang unang hakbang tungo sa tunay na women's empowerment. Ang paniniwala natin sa bawat Pilipina na mabibigyan ng hanap buhay, isang pamilya ang maiaangat mula sa hirap. At sa bawat pamilyang magbabago, isang komunidad ang pwedeng umasenso. Lahat ito, nagdurugtong para pumanday ng isang lipunang pwedeng mabuhay ng may dignidad. Today and beyond this month-long celebration, we are called to intensify our efforts. We need more of us to do this work. Hindi lang mga kababaihan, pero ang buong sangkatauhan. We need more of us to raise our voices for women's rights. More of us to educate and empower others. More of us to make communities safer and more responsive to the needs of every woman. Because if there is any lesson we can draw from this pandemic, it is that there is no better way through any crisis but together. Ang hamon sa isa ay hamon sa lahat. Sa parehong paraan na ang pag-angat ng isa ay pag-angat din ng lahat. Kaya sa inyong lahat, sige lang, tuloy lang, padayon lang. Huwag sana kayong mawala ng lakas ng loob sa panahong ito. Patuloy tayong humanap ng paraan. Patuloy tayong lumikha ng mas marami pang oportunidad para sa ikauunlad ng kababaihan, lalo na para sa mga susunod na henerasyon ng Pilipina. Hindi kayo nag-iisa. Nasa likod ninyo ako at ang buong OVP, along with so many others committed to the pursuit of a fairer, more humane, truly equitable society. Mula sa aming lahat sa tanggapan ng pangalawang Pangulo, isang masaya, makabuluhan at empowering na Women's Month sa mga kababaihang Pilipino. Maraming salamat, mabuhay kayong lahat.
Okay, thank you very much. For that very touching message by our very own Vice President, Lenny Robredo. Yeah. So without further ado, we would like to get the ball rolling and introduce our first speaker for tonight. Okay, medyo bigatin ang ating mga speakers ngayon. So introducing, we would like to introduce our first speaker. She is a BS Biology graduate from University of the Philippines, Diliman. And she also graduated with honors cum laude, and also her Doctor of Medicine degree in UP Manila, and also a medical intern in the Philippine General Hospital, and also a Master in Public Health in Harvard T.H. Chan School of Public Health, Fulbright Scholar, and Ayala Stewardship Fund Scholar. There you go. And also, as part of her work right now, she is currently and up to now is the special assistant to the Secretary of Health for universal health coverage, and also she is the director of the Health Promotion Bureau, and also a director of the Disease Prevention and Control Bureau. Wow! So without further ado, guys, we would like to introduce Beverly Lorraine C. Ho, MD. Hello. Hi, Doc. Good evening. How are you? Yes.
Mabuti
Hope
naman.
you're safe
Thank
and well. You're welcome.
Thank
Yes. Maybe you would like to share some inspiring messages to us, and also some guidelines also, and enlightenment towards this pandemic and crisis that we're going through right now. Not just as a nation, no, not just as people, but but really as inhabitants of this planet. So because a pandemic doesn't really come every day. It's something that comes at least once in a lifetime. So take it away, Doc. Yeah.
Thank you. So allow me to share my screen. So I understand that there'd be 3 of us tonight, and so there are some things that I purposely did not cover in this presentation, as Dr. Nina, who's my professor before, will be discussing some of it. And yes, okay. So my terms of reference for tonight is at least to share with you the plans for COVID-19 vaccination rollout by the government. In particular, the different aspects that would probably help inform how you can participate in the rollout of the vaccines in the country. All right. So first of all, this is the organizational structure. It's very much participated in by various agencies, but you will see on the bottom box here is the vaccine cluster headed by Secretary Galvez, and within it are several smaller task groups who are going to be responsible for various aspects of the COVID-19 vaccination program. For example, the task group on vaccine evaluation and selection is made up of scientists from the Department of Science and Technology, as well as health specialists from the DOH and FDA. But for the other parts, like the diplomatic engagement and negotiation, that's really not within our expertise. No? So that's under the Department of Foreign Affairs, for example, while the procurement and finance is under the Department of Finance. So just to say that this is really an effort that spans the entire government. So next would be basically the different aspects that need to be covered under the vaccination program. And what we just really need to get from this is that it's very complex. Every year, the country or the DOH, together with the local government units in the private sector, actually work on vaccination for kids, right? And in total, every year, if we get it perfect, that's around 2 million kids a year. But this year, we're planning to vaccinate 70 million. So that's 35 times our regular target, no, for vaccination. So indeed, we will require a lot of help from the private sector as well as the nonprofit NGO sector. So I divided the presentation into just maybe 5 questions that would probably be the most important, considering also the information that the questions that have been sent forward. First is, how can we ensure the safety and efficacy of the vaccines that are going to be made available in the country? First of all, I'd just like to assure everyone that there are at least 5 independent vaccine expert groups made up of independent experts, scientists, clinicians, or even experts in supply chain, for example, who are advising the government on the current rollout. So they answer very different questions, and so they have very different perspectives that they actually share with us. In the beginning, we had to, because the results of the clinical trials weren't out yet, but we had to choose who to negotiate with. And so the vaccine expert panel listed down 6 of these criteria, which form the basis of, sige nga, kanino tayo magne-negotiate, no? Kahit hindi pa natin sigurado, kailangan alam lang natin ano yung mga posibleng bilhin natin sa market. So that would include track record of the company, the platform, the safety based on just phase 1 and phase 2 trials pa lang, immunogenicity, potential efficacy based on phase 3 interim results, and dosing schedule, no? How easy it is to implement it. Thereafter, we had to, when we got the phase 3 data already, the interim phase 3 data, then it was important for the government to say, okay, sino dito yung authorized to be used in the country. So in normal times, you would, any technology, be it a medicine or vaccine, would get a CPR, the bottom right-hand corner of this slide. No? It's called a Certificate of Product Registration. And this slide basically answers the question that we see on the internet now. Why is the private sector not actually being allowed, no, to buy vaccines on their own? Ayaw lang ba ng gobyerno? O ano ba talaga yung reason, no? So maybe a lot of you who are in the business sector would know that when you're probably just developing something, hindi pa siya ready for market, you actually don't want to guarantee, di ba, the quality of your product, or that you will be answerable to it kasi hindi ka pa sure, no? Or hindi ka pa sold na yun na yung product mo. So this is basically what's happening now. No? The products, the vaccines are in their phase 3. of their clinical trial, pero hindi pa sila tapos. No? They're not yet done with phase 3. But the experts all over the world have looked at the data and said it's safe and efficacious enough, and the benefits outweigh the risk. And that's why there's actually a reason for us to use it. Since hindi pa tapos yung phase 3 trials, it's impossible to give them a certificate of product registration. And so what they're getting now is actually an EUA. No? So short of a CPR, they're getting an EUA based on interim data. So what does an EUA mean? No? So there, in the past, if something happens, negative event happens, then you're able to actually sue the company because you already gave them a permit, a CPR. But in the case of an EUA, it's the national government that takes on that responsibility. Kasi parang tayo yung nag-request sa kanila na gagamitin namin po yung product niyo kasi kailangan na namin siya. No? And because it's only national governments who's going to be able to pay for that indemnity, then it is just but natural for the private sector groups to say, the manufacturers to say they won't transact directly with smaller private entities, no? Kasi hindi naman yon yung magbabayad kung may ano yung mangyari. So they were the ones who insisted that if they're gonna sell to the private sector, the national government has to be part of that deal. So national government yung sasagot kung may mga maging problema. So here we just summarize the different vaccines that are being considered and those that have already gotten their EUA. So next, a concept that I just like to reiterate now is severity of COVID-19 infection. Oftentimes, pag nakarinig tayo, may na-COVID siya, no? Parang it seems like we only have one mental picture of what this is. But the reality is, may mild, moderate, at severe COVID, no? At yung severe COVID, that's the reason why we're all scrambling for the vaccines, di ba? This is the reason why we're also worried, because if it was just mild or moderate COVID, that's simply like your trangkaso, no? But it isn't. It has the ability to kill people. And this is the reason why it became so high profile, no? As a infectious disease, di ba? Ang dami namang ibang sakit, bakit siya pinagtutuunan ng pansin. And so later on, this is going to be the reason why the severe COVID is going to be, should be a reason why you will look at certain factors when you evaluate vaccines on what you're going to use. Specifically, here are the data from 2 vaccines that are currently in the Philippine shores. No, one is Sinovac and one is AstraZeneca. And the way you would look at the efficacy data here should be the way you would look at all other vaccines, no? At ito yung bakit sinasabi nila, the best vaccine is the vaccine that's available or that's in your arm. If you look at the data on how the vaccines are preventing mild or moderate COVID, hindi siya 100%, no? So ito yung pinagtatalunan ng mga tao na 50, 60, 70, 80, 90. But actually, what we need to look at is its ability to prevent severe infection. Kasi actually okay lang tayo kung mild infection yung COVID, di ba? Kaya natin yun, parang sinipon lang tayo. But it's the severe COVID that we actually don't want, no? And hopefully, after today's session, this is what you're going to always ask your healthcare provider regarding the profile of the vaccine. Don't look at just 1%, no? Look at how it prevents severe infection. Now, Okay, so the next question that we often ask ourselves is who needs the vaccine first, or sino mauunang babakunahan, no? And for this, let's just look at this graph. Let's be evidence-based. The cases of COVID affect 20 to 39 years old, but the deaths of COVID really come from elderly, and we all know that. And that's perhaps one of the reasons why when we prioritize who should get the vaccines first, the frontline health workers and the senior citizens are in the top 2. But sometimes people ask, sino mauuna, no, if the vaccines are not enough? Then the second level criteria would be geographic location, if high burden yung COVID. So between someone in Batanes and someone in NCR, mas marami na tayong dinistributan ng vaccine sa NCR. And finally, exposure, no? So among healthcare workers, nauna po, no, yung mga frontliners. So even if I'm a doctor, I'm not yet vaccinated because I'm not considered a frontliner because I don't see patients on a day-to-day basis. Then the next, sorry. And then within the healthcare workers, then there are specific sub-priorities. No? So we finish the hospitals first before those in quarantine facilities and so on and so forth until we go to closed healthcare institutions. Now, what do we generally have to expect, no, when the vaccines are rolled out already? First is that there will be house-to-house level social mobilization strategy, particularly among low-income households, but our vaccination will be fixed point. No? Ibig sabihin, no one will go for your house call to give you a vaccine, but generally you have to go to a specific health facility. Bakit? No? We expect also everyone who's going to be part of the vaccination planning to undertake these initiatives. No? First is to do master listing even in your company. So kung hindi kayo bumili, hindi kayo naging part ng tripartite, then you will have to master list yourselves with your LGUs. Then whoever is implementing, in this case, mostly LGUs, they have to do the micro planning, meaning they have to be able to map where the sites are, do the training, do the simulation, etc. Then there are also data management systems that they have to link with the national government. The DOH also provides for the standards for implementation. So these are what the LGUs and some private sector groups will have to follow. No? So we say, okay, ito yung site, you need to have X, Y, and Z in those area, number of people, and for each team, ilan yung mga tao dapat, no? Because it is protocolized. Then you also need to make sure that the posts are going to be near or accessible to the nearest hospital. So overall, the process is as follows. No, you go for a registration, then you get sort of a health education and a consent, no, a review of your consent form. Then you get screened by the healthcare worker. If indeed, pwede ka bang bakunahan, no, may iba ka bang symptoms, mataas ba yung blood pressure mo, then you get vaccinated. Then after you get vaccinated, you have to stay there for 15 to 30 minutes or maximum an hour. And that's when all of the most of the adverse events would actually happen. And later on, Doctora will expound on it. So overall, the layout looks like this. No, you wait in a certain area, then sunod-sunod na yung registration, consent, screening, vaccination until you wait it out in the post-vaccination monitoring area. So syempre, hindi naman lahat ng area ganito kalaki, no? So merong variations. In some hospitals, it became separate rooms. In some areas naman, they preferred to use, say, a basketball court, for example. Then there are standard informed consent forms and vaccination cards that will be provided, and even health assessment forms. No, I won't go through this in greater detail, but there are criteria for certain people to not get vaccinated, for them to defer vaccination or move it just down a few weeks or a few months. There are certain people who would need medical clearance, and finally, there are people who would need special precaution. No? Like kung you have bleeding disorders, then early on, merong mga special gauge needles or mas maliit na needles na gagamitan. So the post-monitoring period, as mentioned kanina, 15 minutes for the general population and 30 minutes for those with history of allergies and asthma. So gusto lang din namin i-emphasize, no, that we take adverse events monitoring pretty seriously. So all of these are in place in areas designated as vaccination sites. So then the question that many of you always ask, or we hear about, is when are the vaccines arriving? So we know that 80% of global supply has already gone to high-income countries. But just yesterday, Secretary Charlie has put out this chart showing you when the vaccine deliveries are likely to happen. We'll just leave the slides with the organizers. I won't go through this in greater detail. And also when we expect 140 million doses to arrive this year. No? So this is, of course, subject to availability and in the global market. So we also have allotted enough resources to get us the vaccines. So many would also say, okay, granted the vaccines are going to be in the country, how do we convince as many people to get vaccinated? Well, we know that there's actually a range of vaccination positions that people take on. No? So from advocating papunta na dun sa activists or the anti-vaxxers as we call them. In many of the guidance from WHO, we are advised to focus on the first five, meaning many of our efforts should gear towards yung rejecting part, hesitant, accepting, demanding, and advocating, and really just minimize the impact of the anti-vaxxers. No? We have to use our limited resources to get most of these people vaccinated. So this model is what's really being used now in terms of making sure that people are ready to receive the recommended vaccine and are not just motivated to do so, but enabled to do so. So we focus on a lot of the pink boxes through various mechanisms that we have, and that's largely through sessions like this, town halls with different sectors, running surveys, and customizing our messages for different audience segments. So ibang-iba yung messaging for class ABC versus CD, for example. And for that, we work with our private sector counterparts, the Ingat Angat group, in terms of coordinating our messaging. Then we do have a whole range of things that we do, particularly social listening and multiplying a lot of champions in the different sectors, knowing fully well that healthcare professionals are going to be the primary influencers. No? And so now we're really riding on the bandwagon that's being created by the vaccination of our healthcare workers. So I leave you with this infographic that contains all the links to several of the materials that we have already produced, whether you are a champion or just disseminating materials in your social media platforms or the policies, everything is here. Finally, maybe a lot of people always ask us, pwede na bang tigil yung pagmamask after the vaccines have arrived? No, so far, CDC has very limited guidance on this, telling us that it's possible, that we don't have to wear our mask when we are with people who are also vaccinated. But in general, we know that this is really the frame of mind that we need to have when we talk about vaccines. Vaccines is just going to be another layer of protection among many other things that we need to do. And while the variants are still not as heavily studied, we need to keep ourselves and our family protected. If this is difficult to remember, then I'll leave you with this, Kung ayaw nating makagat ng lamok, we actually don't do just one thing, diba? Hindi lang tayo nag-insect repellent. We do many other things like putting screens in our homes, use the katol, sleep under the mosquito net, and many other things. And that's really just how we need to view vaccines as part of a whole range of initiatives. So that would be all from our end. And thank you very much for this opportunity to share this advocacy with all of you. Thank you.
Thank you so much, Dr. Beverly Ho. I am sure a lot really appreciated your segment. It was very well explained, and honestly, the process was clear. It was very clear. Now,